Good afternoon. My name is Jason. I'm here to do my NG tube video. So the first thing I'm gonna do is knock on the door, do hand hygiene, and introduce myself. Hi, my name is Jason. I'm gonna be your nurse. I'm here to do your NG tube. Can you tell me your first and last name? Can you tell me your date of birth? After the patient is verified, I'm going to ask him if he's ever had this procedure done before. Sir, I'm here to do an NG tube on you. Have you ever had this done before? Patient's going to tell me either yes or no, then I'm going to explain the procedure. This is a tube that goes into your nose, that goes down into your belly, that helps decompress your belly if need be, or allows us to evaluate what's going on inside your belly. And then I'm going to go ahead and do my procedure. So the first thing I'm going to do is gather all my equipment, make sure I have everything with me. All right, and then, that's all up here. I'm going to evaluate the patient's nose. Can you take a deep breath in on this side? All right, and hold the other side, take a deep breath in. Can you tell me which side you breathe better out of? I'm gonna inspect it to make sure I have a clear pan airway. It appears to be good on both sides. So I'm going to choose the side closest to me. I perform hand hygiene, I have gloves on, I said that earlier. And then now I'm going to measure my NG tube from the nose around the ear down to the xiphoid process. It has little marks right here to tell me where I'm at. So I can either mark it with a pen or just go ahead and have it memorized. Right now I'm at 65. Let's see if I have some tape somewhere here. I don't remember having any, but let's see if I have any extra tape somewhere. Perfect. I have some right here. All right. So now I'm going to take some water-based jelly. I'm going to apply it to the tip about 4 inches down. And then I'm going to explain to the patient, I'm going to stick this tube into your nose. I'm going to need you to hyperextend your neck all the way up. And then as soon as I meet some resistance, I'm going to have you bend your head down. I typically have my arm like this around the patient. This way it keeps better control of them if need be. Okay, sir, can you hyperextend your neck all the way up for me? All right, I'm going to place this lubricated tip into your right nair. So it's going to go in. I'll meet some resistance. As soon as I meet resistance, I'm going to have him bend his head downwards. I'm going to look in his mouth. Sir, can you open your mouth real quick for me? All right, it's clear, nothing, no tube is down the mouth. And then I am going to, if I have an assistant, have the patient drink some water while I insert the tube. I'm going down to 65. All right, sir, I'm going to have you swallow as soon as and I'm going to feed this tube down to your belly, okay? Can you keep swallowing for me? Good, and swallow. Swallow, 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 swallow. All right, at this point, the tube should be down to his belly. I'm gonna assess the patient. Can you tell me your name? The patient's able to talk. I'm gonna look at the patient's O2 sat, make sure it's still in the right range. So all that is good. Let me, typically I would listen real quick, but just because I don't have any way to hold this on, I'm just gonna throw some tape on there just for the time being. Okay. Oh. So I check the O2 sat, patient's able to talk to me. I'm gonna check gastric contents as soon as I make believe this is secured onto him. All right, I'll fix that later. Okay, so now I'm going to take my syringe, not place it in the vent hole, but place it in the normal vent. I'm going to draw back. I'm going to aspirate to make sure I have gastric contents. I'm going to take, if I have pH paper, I'm going to go ahead and test this. So I'm going to place wherever the pH paper is. It obviously won't be here, but I'm going to put some gastric contents on the pH paper to make sure it changes colors. And then I'm going to draw back some air, place it into the NG tube. I have a Salem slump, and I'm going to listen over the epigastric for gurgling. So I'm gonna hold it right here, listening. All right, I got gurgle in the belly, so that confirms I'm in. Since I'm in, now I can go ahead and secure this tube to the patient's nose. So I take a piece of tape, I rip it down the middle for a little chevron. I would take all this stuff off real quick. I would tape it onto the patient's nose. Take the one side of the tape, or one side of the tape, and wrap it around the tube, and then do the same with on the opposite direction with the other side. And then I'll just take another piece of tape and stick it on top. If I can get some tape. Another piece of tape just to keep it on there for secure measures. At this point, if I'm just doing a nasal gastric tube, I would document my procedure. So I would say I have an NG tube, which is, let's say, dual Salem slump, 8 French at 65 centimeters in. I have clear gastric contents, and patient is clear bilateral breath sounds and gurgling over the belly. So all that would be documented, but because I'm doing an NG lavage, I am going to now take some saline, normal saline or sterile water, or normal saline, place it in here. So I'm going to aspirate some normal saline. This is after this patient is already connected to low intermittent suction. I'm going to assess how much fluid and the characteristics of the fluid and chart that. Now I'm going to do my NG lavage. So I am going to take 60 cc's of normal saline, place it into the NG tube, slowly push. I don't want to push too hard because I don't want to blow any clots if the patient has ulcers or anything, GI compromise. So push 60 cc in, syringe in. I'm gonna go ahead and attach them back onto the normal, or to the suction at low intermittent suction, and I'm going to watch for all 60 cc's to get suctioned out of the patient. Once that's done, I'm gonna do it again. So draw back 60 cc's, place it back in, slowly push, switch it out to the wall suction, low intermittent suction, and then draw all the fluid back out. If I don't have low intermittent suction, I can always use a syringe and re-aspirate what I put back in. But because I have that, I'm gonna put on the low intermittent suction, and then now I'm gonna document my procedure. So I'm gonna go in and chart that NG lavage is performed with however much I did. At this point, I did 120. 120 has came out. It appeared to be clear. And then I'm going to tell which narrow it was from, how deep the NG tube was in, and the size. That was it. Thank you.